Hello students, my name is Talshin Dalilkhankaze. I am a teacher from the Department of Children's Infection Disease, and today I will demonstrate to you lecture about viral intestine infection in children. Plan of our lecture, today we will talk about types of and mechanisms of viral diarrhea development, etiology, epidemiology, pathogenesis, clinical manifestations, diagnostics, and treatment and prevention of viral diarrhea in children. Types of diarrhea in acute intestinal infections divided to three types: invasive or exudative, osmotic or watery stool with flatulence, and secretory watery stool without flatulence, and mixed form. First one is invasive diarrhea. What happened here? Adhesion and invasion of bacteria to the epithelial shell of our enterocytes will happen. So, as a result, adhesion, colonization, and inflammation of our GIT tract will happen. So, the presence of erosive or necrotic wound process in the colon is known as like hemocolitis syndrome, and the hematological and coprological signs of inflammation, and the presence of any clinical variants of infection toxicosis can complicated by dehydration syndrome or syndrome of neurotoxicosis or hemolytical uremic syndrome. Next type of diarrhea is osmotic diarrhea. Osmotic type of diarrhea mostly caused by viruses. The classical clinical form of osmotic diarrhea caused by rotaviruses, as you know. Infection will spread, of course, by fecal-oral route, and the pathogen will penetrate to GIT tract from our stomach to intestine, mostly small intestine. Here, these viruses will produce toxins which cause necrosis of the villi of the enterocytes, which answer to absorption of carbohydrates. So, already breakdown carbohydrates can't absorb by our enterocytes, so it will happen the increase of osmotic pressure in the lumen of our GIT tract, and if osmotic pressure will increase, water and electrolytes start to move from the cell to lumen of our intestine. So as a result, we can see watery stool with undigestive or digestive food mass with flatulence also. And in this infection, dehydration syndrome will be very fastly occur. Next type of diarrhea is secretory diarrhea, mostly caused by variety bacterial infections. The classical type of secretory diarrhea caused by cholera, which bacteria will produce toxins. This pathogenic factor of bacteria will activate adenylate cyclase mechanism, so production of the CMAF will be increased, and of course secretion of sodium, potassium, and water will be increased without inflammation, without fever, without abdominal pain. Patient will have, without flatulence, abnormal liquid stool with in very big amounts, and repeated vomiting, and the rapidly presence of the dehydration syndrome to the dehydration shock can be occur. So, viral intestine infections, they can cause mostly by variety viruses. On the first place are rotaviruses, astroviruses, norovirus, enteroviruses, adenoviruses, corona and cytomegaloviruses, and others also can cause viral intestine infection. You must know, like, more than 90% of all cases diarrhea in childhood caused by viruses. Epidemiology of viral infection disease. Source of infection are sick person or sometimes virus carriers. Transmission are by fecal-oral route, sometimes aerosol route also. Ways of transmission, of course, is alimentary, household, and airborne. About pathogenesis of viral diarrhea, we already told before. Mostly, it's characterized by osmotic type of diarrhea, when osmotic pressure in the lumen of intestine will increase and carbohydrates breakdown will disturbed and absorption of them also. So as a result, we will have flatulence and watery stool. Syndromes of viral diarrhea. Viral diarrhea is mostly during with intoxication syndrome, dyspeptic syndrome, pain syndrome, syndrome of neurotoxicosis, intestinal toxicosis with execosis or dehydration syndrome, and metabolic syndrome also. First infection disease during with the classical osmotic type of diarrhea, viral intestinal infection is rotaviral infection. These viruses will damage our GIT tract and are characterized by gastroenteritis. Acutely onset with short-time fever. Fever mostly will have febrile grades, 38, 39 degrees of fever, and general intoxication syndrome, weakness, dizziness, malaise, lack of appetite, and etc. Then sometimes catarrhal syndrome also can find, like dry cough or just hyperemia of the oropharynx, you can see. And next one is development of, from first day of illness, dyspeptic syndrome. Patient will have short time vomiting, mostly lasts 1-3 days. Then watery stool, liquid stool up to 15-20 times a day, and with flatulence, and the patient will have ends by dehydration syndrome. Stool in rotaviral infection, just the watery with undigestive, digestive foods by neutral fats and by starch and etc. Next infections also can cause the viral diarrhea in children. There are noroviruses and astroviruses. Clinical manifestation of them, of course, are same, all of them during this dyspeptic syndrome plus by intoxication syndrome. As if noroviruses, mostly in 19%, the main sign will be nausea, then vomiting, only in 40% of children, characterized by watery stool. Astroviruses mostly can damage children aged 3-4 year aged, and diarrhea can be only one sign of disease, and duration diarrhea lasts mostly 2-3 days. Next infection disease also very often meeting in childhood are adenoviruses and enteroviral infections. Adenoviral infection, we know, is like this group of viruses, DNA containing adenoviruses from the respiratory viruses family. They characterized by variety clinical manifestation as a fever, catarrhal signs like conjunctivitis, rhinitis, pharyngitis, tonsillitis, lymphadenopathy, hepatosplenomegaly syndrome, plus diarrhea also can be myths. Next infection is enteroviruses. Enteroviral infection, also viral infection by fecal oral route of transmission. In this infection disease, they characterize a lot of different viruses included in one family, like ecoviruses, Coxsackie A and B, human enteroviruses. So if a lot of causative agent, a lot of manifestations will be like herpetic angina, hand-foot mouth disease, like rashes on the feet and the palms and all body, plus abdominal pain, as a result of mesoadenitis, inflammation of mesenterical lymph nodes, and the gastroenteritis can be one of the signs of enteroviral diarrhea. Next infection disease, very famous disease today, is coronaviruses. Coronaviruses mostly damage our respiratory tract, characterized by intoxication syndrome and by bronchitis, pneumonia, very severe pneumonia. And one of the signs in children can be enteritis, but characterized watery stool but short time, mostly about 3-4 days. Next infection disease is cytomegaloviruses. Most of children has a congenital cytomegaloviral infection, and you can ask patient, maybe they have afterburn, long time jaundice, damage of the eyes like iridocyclitis, bronchitis, severe congenital pneumonia, maybe anomalies of the nervous system, and also one of the signs can be prolonged diarrhea, enteritis syndrome. One of the complications in viral infection disease in children can be occurring of neurotoxicosis syndrome, which characterizes of the toxic brain edema, hyperthermia fever, and development of the convulsions. These patients, first they will be very stable fever with the recentralization of our hema circulations. Patients' cold will be very cold, and the next stage convulsions can also occur. And mostly white type of hyperthermia will occur in these children. One of the next most often caused complication of viral diarrheas are development of dehydration syndrome. And we know like three types of dehydration right now in children. We use IMCI syndrome chart booklet, and by IMCI we know like moderate dehydration and severe dehydration. But sometimes we can use dehydration of first, second, and third degree. What happened? Dehydration in first degree, patient will lose up to 5% of his body weight, and the consciousness is preserved. Patient has the pallor of the skin, turgor of the skin and tissues are preserved, and the heart tones are clear. Slightly tachycardia can present, and blood pressure will be normal, and the levels of potassium and sodium will be also normal limits, and the hypercoagulation tendency will occur. Patient looks slightly weakness, and you can see sunken eyes in this stage. Second stage of dehydration, patient will lose about 6-9% of body weight, and the consciousness in this stage will agitated, restless, or painful, irritated baby. They feel thirsty, have sunken eyes, decreasing of urination as the oliguria, heart tones will be muted, tachycardia, and hypercoagulation signs will present. And the severe diarrhea, dehydration of third degree, characterized by loss of the body weight more than 10%. Consciousness will decrease to sopor or coma, and the patient have dry sclera, dry skin. Skin pinch will goes back very slowly. Hypothermia, tachypnea can be. Heart tones also is muted. Anuria is present in this form. But right now we used classification of diarrhea and dehydration according IMCI program, which made by WHO organization, and in this by this program we mostly will check the general signs of the dangers. There are patient drinks, how drinks patient, has convulsions, about his consciousness, and presence or absence of convulsions in baby. Next one is, can baby drink or breastfeeding, has a vomiting, convulsions, and check his consciousness, lethargic or unconsciousness. And how classificate? If patient has diarrhea, we must ask, does the baby diarrhea? If yes, how long? And the next question is, any blood in the stool or not? Next one, look at the general condition of child and evaluate. First one, patient is lethargic. This is very sleepy baby, or unconsciousness. He didn't react to anything. Next one, he's restless or irritable. Crying baby, yes, for example. Next one, look for the sunken eyes. If you don't know or you are confused, ask the mother. Your baby's eyes look sunken or normal. Next one, you must check how baby drinks. He drinks normally, he drinks thirstily, or he can't drink. And last one, reaction of the skin pinch. We will take in the abdominal region, both sides of our umbilical region, pinch of the skin, and check how they will go back. If they will go back very fastly, we will assign it like immediately. If you can see how this spin pitch goes back about 2 seconds, this is slowly. If he will stay and more 2 seconds, very slowly. Then we will summarize. So by the finding followed signs, we can classificate conditions. If patients hasn't any signs of general danger signs, just he have only diarrhea, there are no signs of dehydration, we will assess and classificate it like diarrhea, no dehydration. This patient should be treated by plan A. If you find two of the following signs, there are patient restless or irritable, he has sunken eyes, he drinks tersely, and skin pinch goes back slowly, classificate it like moderate dehydration, and this patient should treat it by plan B. And the third one, if patient is unconsciousness or lethargic, he has sunken eyes, he can't drink, and skin pinch goes back very slowly, classificate it like severe dehydration, this patient should be in the red line, red zone, and treated by plan C. So, if diarrhea lasts more than 14 days, we will classificate it as severe persistent diarrhea. If with prolonged diarrhea, patient have signs of severe diarrhea. If there are no dehydration, just only diarrhea lasts more than 14 days, is persistent diarrhea. And if patient has blood in the stool, you must classificate it like dysentery, and patient should be treated by ciprofloxacin. This is only by IMCI program, but presence of the blood in the stool, it not means always dysentery. You must do consultation of the surgeon or look for the other problems. Maybe one of the problem is because of dysentery can be. How diagnose viral diarrheas? Diagnostics based on general clinical analysis like CBC. There are no specific features. Opposite leukopenia can be, and we will see to the coprogram. In coprogram also there are no inflammation. Only we can find undigested fiber, starch, fatty acids, and etc. And the specific lab test based on serological and molecular genetic methods. Serological, mostly we used ELISA methods, detection of antigens of viruses in the feces, and to molecular genetic methods we used PCR to look for the genome of viruses, RNA or DNA of viruses in the feces. Differential diagnosis of viral intestinal infection, of course, we will do with bacterial intestinal infections like salmonellosis, cholera, intestinal endometriosis, and others. How treat viral diarrheas? Treatment of viral diarrheas based mostly on saving a regimen, diets, and prevent or treatment of dehydration syndrome by IMCI program. If patient has just a diarrhea without dehydration by plan A, if patient has moderate dehydration by plan B, and if patient has severe dehydration by plan C, and symptomatical treatment will used. Hydration therapy, mostly we will use water electrolyte balance and detoxification therapy, antidiarrheal medications, and enzymes can use here. I want to say about treatment of dehydration by IMCI program. By plan A, we will give to patient ORS. ORS by plan A, if patient aged under the 2 years old, we will give 50-100 ml of ORS after each loose stool. If patient elder than 2 years old, we will give 100-200 ml of ORS after each loose stool. If baby is breastfeeding, you must continue breastfeeding. Just you must give slowly, step by step, ORS or just breast milk or water. By plan B and moderate dehydration, we must in 4 hours period give amount of ORS to baby slowly, but in 4 hours. We will multiplying weight of baby to 75 times, and this volume we must giving in 4 hours. And by plan C, baby can't drinking, we will mostly use rehydration by intravenously infusions. That's all. My lecture is ends. Thank you for your attention.